Welcome to the Dr. Dare Show. My name is Dr. Frederick Dare. I am a therapist here in Atlanta, Georgia, and welcome to my channel. But before we get started, make sure you subscribe to my YouTube channel, like this video, share it, and click the little bell at the bottom of the screen so that you will get updates of when I upload new content. So, what I've been doing for the last couple of shows, I've been doing interviews with essential workers, and today we will continue that. And I will be interviewing a hospital worker. Again, the hospital will remain anonymous and the guest will remain anonymous. And so we will call her Jane Doe. And so what we want her to give us is just kind of what she does on a daily basis, what she comes in contact with as it relates to COVID-19 as much as she can with the HIPAA laws and stuff like that. And then we want to touch on like the emergency room. Is it safe to go to with non-related COVID-19 issues? And then lastly, how can we help her and her staff do their job better if we're prepared? So welcome, Jane Doe, to the show.
Thank you.
And so I know I've named a lot of things just a second ago. So can you just kind of give us what you do at the hospital on a daily basis, and then kind of what you've been seeing since COVID-19 to kind of help them?
Yes.
All right.
So currently I am a registered nurse. I work on the vascular access team. And for people who don't know what the vascular access team is, that's a team that the hospital has designed to go to patients who the nurses or the physicians may have a difficult time getting IV access on them to give them the medications that they need. So we are called to the rooms to see patients pretty much all day. Okay. And we have been seeing COVID patients. There has been an increase in the volume of patients we have seen needing access on their patients. The patients are sicker. And we are seeing an influx of patients, but it's more so just COVID patients. We're not seeing a new influx of other things. We're only seeing an influx in the COVID patients currently.
Okay. And so since Georgia opened, have the cases like increased with COVID, do you think, in your opinion?
In my opinion, I have not seen an increase since the whole COVID quarantine and everything has happened. We have seen it come and go in waves. Okay. Currently, I feel like we're in one of those waves. So we went, at the hospital I work at, I feel like we went down really low, and then we came back up. I feel like we came back up before the state opened back up, and we've kind of stayed at that steady mark since the state has opened back up.
Okay. That's good. Good to hear. When I was talking to another hospital worker, we were talking about the emergency room and how a lot of people are afraid to go to the emergency room, which is one reason why I really wanted to do this show, is people are not going to the emergency room because they're afraid that I guess they're going to catch COVID-19. So what's your advice on that?
So my advice on that is COVID is definitely real. It's definitely out there. Most hospitals that I have encountered and other colleagues that I've talked to, the emergency room is taking all the precautions needed to prevent COVID from spreading, per se, in waiting rooms or spreading while you're waiting to see someone and you came in with something unrelated. We're doing our best to isolate you from patients who may be showing COVID-like symptoms. Our testing is coming back quicker and quicker. So my advice is, if it is a true emergency, meaning you have no idea what to do, and in the next 15 minutes or less, your symptoms could take a turn for the worse, don't hesitate to go to the emergency room. Those are the things that, there are some things that you definitely should still go to the emergency room for. If it's something that may be able to wait for a day, I definitely advise that you call your physician, call your healthcare providers, and let them advise you on what to do, because they may even be able to isolate you even more. But please don't stay away from the emergency room if it's an emergency. The staff at the hospital that I work at, every staff member from environmental services to the physicians, everyone is required to wear a mask from the time we hit the door to the time we leave out of the hospital. So we're taking necessary precautions. We're also giving patients masks. We're routinely screening the patients. We're routinely checking temperatures. We're limiting visitors. So the risk is still there, as is the risk going to the grocery store or going out to get your essential items as well.
Exactly. And so what I saw on WebMD, and you can correct me if I'm wrong, it was saying like things to go to the emergency room for is like severe cuts, chest pains, trouble breathing, like eye injury, and seizures. That was basically
Absolutely
the list that they had on there. Okay. And so another thing that I was talking to another hospital worker about is going outside. Do you think that people should get a certain amount of fresh air and not just shelter in place?
I am definitely an advocate of getting outdoors. A lot of times we forget about the mental health of our patients, and
Yes.
if you can safely get outside and get some fresh air and get some vitamin D from the sun and just kind of get out of the four walls and still be social distance and still maintain adequate social distance, and then I say go for it. I don't think we can stay in a box and be boxed in and not live at all. But we want to do it responsibly and we want to do it safely, because I do not agree with going out in crowds or going out with others. If it's not safe to do so, then I don't say go out.
Right. Because what I've just started doing, and I'm guilty of staying in more so than going out. I recently just started going outside to walk in my neighborhood alone with the mask
Definitely.
on. Because,
Definitely.
like you said, it is important for your mental health. I was talking to another hospital worker about it's starting to impact people's mental health, and they're showing up to the emergency room like dehydrated because they've heard someone say that COVID is in the water unless they're drinking like bottled water or something, and they would stay in the house and get dehydrated, or drinking like Lysol or something to kind of get rid of the COVID stuff, or they hear on the news that vitamin D is good for COVID, which they really didn't say it was good for COVID. They just said a lot of patients that were showing up had low vitamin D levels. And so what people are doing is like taking whole bottles of vitamin D vitamins. And so I'm here to say, I'm not an expert though, but I'm here to tell the people that are out there that are listening, if you normally, before all of this stuff started, you would not normally take a whole bottle of vitamins. You would not normally you would not normally drink bleach, or you would not normally drink Lysol. So don't do that. And for me, I'm always listening to Dr. Fauci or some of the other, Dr. Gupta, I think. All of these people are on CNN, but they're doctors. I listen to them as far as what things that I should be doing and kind of just keeping safe. But you have to get out there because it's going to start impacting your mental health.
And just to talk about the vitamin D, not to cut you off, but
good.
Vitamin D. One thing about vitamin D that a lot of people should realize is that the one of the best sources that you can get vitamin D from is the sun.
Okay.
And we're all staying indoors right now. We're all in the house. So our vitamin D levels are going to naturally go down. They're going to decline because we're not getting that natural sun, that natural sunlight. We usually would get vitamin D more in the summer, and sometimes they would see a decline in the winter months because we're in more in the winter months.
Oh, yeah.
So it does make sense that a lot of people's vitamin D is low. If you've been quarantined for weeks, your vitamin D may take a drop. Most people are not going to notice any difference in their vitamin D level dropping just a little bit. But some people may notice some bone aches. Some people may notice a little fatigue. But just go out on your porch, get a little vitamin D from the sun, And that's the best source of vitamin D that you can get. Go out on your porch for 30 minutes. Like you were just saying, take a walk outside, and that's a good way to get vitamin D. Because again, if you weren't doing a bottle of vitamin D before the COVID started, then definitely talk to your healthcare provider before starting on any kind of new supplements. But one thing you can do is go outside and get natural vitamin D.
So that does explain, and I'm glad you said that, because that does explain that drop that they probably were saying that they've seen in COVID patients. And people just take those things to the extreme, and that's kind of what that other hospital worker was saying, that they're seeing the extreme things that people would just not necessarily doing. I know we're all afraid, or we're all unsure about the COVID and how you catch it, and I know that's still questions out there. But don't do anything that you normally wouldn't do, like take a bottle of vitamins or something like that. So,
now, what we are seeing are a lot of patients coming in being overly cautious, and it's starting to backfire a little bit. And when I say overly cautious is, in my opinion, wearing gloves 24/7 is not the best practice if you're not going to wear gloves the correct way. If you're touching every surface with the same gloves, then it's just like having dirty hands.
right.
And we can easily sanitize our hands by washing them in the sink or using hand sanitizer, but it's not as easy to clean the gloves when you're wearing them from surface to surface. So just be mindful when you're out and you're wearing gloves or you're wearing masks. And I've noticed people are pulling the mask down to talk or to, say certain things or to cough, or just it's irritating, so it's getting a breath of fresh air while they're walking around. Just be mindful. Hands in the face are not a good thing.
Right.
Especially if you're wearing those same dirty gloves, it's best to sanitize your hands before you remove your mask. And just remember, if you touch something, your hands are no longer clean, so they shouldn't be near your mouth, they shouldn't be near your eyes, and they shouldn't be near your nose.
Thank you for that advice. And I guess I'm guilty of not wearing gloves because I feel like I can't control keeping them clean. So I just make sure that I don't, like if I go outside for my walk, I don't touch the mask that I'm wearing, and I just keep my hands kind of on my phone or just busy doing something so that I'm not touching my face. And then immediately when I get in the house, I go straight to wash my hands before I even touch the mask.
Absolutely, and I'm glad you said phones. Clean your phones.
Yes. And keys and all of that stuff that you're carrying with you when you go out. Okay, perfect. So what's some things that you can that would help your staff if we did before we had to come to the hospital? I don't know if that question is kind of making sense.
So the biggest thing is definitely if you're having those red flag symptoms, don't wait to come in. We are seeing people come in sicker, and when I say red flag symptoms, that's difficulty breathing, unable to catch your breath, just feeling like just not yourself. If something doesn't feel right, it probably isn't right. So definitely don't stay away. If you're having symptoms of facial weakness, numbness, just any of those symptoms, you're feeling faint, you're feeling just, like I said, just not yourself, those emergency symptoms, please don't stay away. Okay. We would rather for you to be extra cautious and go ahead and come in than not. If you're feeling like you're getting the cold, those are the things that you can call your physician about. You can call your healthcare team about. If you're feeling like this is something, the beginning of a cold or something that started before, I felt like I felt last year when I was getting a cold, those are things we want you to call the physician and check with them on what to do, and they can advise you on whether they want to set up a telemedicine visit or whether they just want you to stay in and quarantine until those symptoms go away. So those are some things that will help the staff out. Again, if you're having those symptoms, call your doctor first. But if you're having those red flag symptoms, don't wait. Okay. And usually they don't start with red flag symptoms. They usually start with mild symptoms. So hopefully you had already been in touch with your physician and they're aware of what's going on and it's expedited. But just remember, if it's an emergency situation, you just don't feel right about it, please don't stay home and try to wait it out.
Okay. So you can go to the emergency room if you meet those criteria that Jane Doe said.
Yes.
So, well, thank you so
And
much.
also remember,
Oh, go ahead.
urgent cares are still open as well.
What's that?
The urgent care centers within most cities are still open, so urgent
Okay.
care is a good one to go as well if you're just unsure of if the emergency room is where you should be or if you should be at your physician's office. The urgent care can kind of help you decipher whether or not you should be in the emergency room or not as well.
Okay, so they still have the walk-ins, like you could just walk
Yes.
in and okay, perfect.
Mhm.
Okay, and I didn't even think about that. So that's
Mhm.
perfect. Urgent care, people out there. So anything else you want to leave us with? Because that was great information. This is
Thank you.
okay, and this is kind of what I wanted this show to be about, just information to help people. Because I know people are kind of nervous about COVID-19 and the unsure if you have it, if you don't, if how it's caught, all of those things. But again, don't sit in the house and deprive yourself of the sun and
Mhm.
stuff that you would naturally do. And don't over clean your house and sit there and inhale bleach. That's
Exactly.
another. That's another
Exactly,
thing.
and the CDC definitely has some good recommendations. We just don't know at this point. We know a lot about COVID-19, but we don't know everything.
Right.
So definitely keep yourself up to date on the CDC's website. As they get information, they will share it with everyone else. And just continue with all the tips that we just mentioned, and stay safe out there.
Yep.
Just stay safe.
Well, thank you for being a guest, and everybody. Hopefully, you use all this information and it's going to benefit you. Thank you, thank you, thank you, thank you, Jane Doe.
Thank you.
You're welcome.
Thank you.
Bye.